Congratulations on your purchase of Midwest's Comfort Control Syringe System. The intended use of this video is to provide basic installation and operation information on your Comfort Control syringe. Please read the Instructions for Use manual that is included in your CCS system for additional information and before using the product. Your Midwest Comfort Control Syringe, or CCS, is an electronic pre-programmed injection delivery device which gives you the control you need to make your patient's dental experience as pleasant as possible. This is achieved by dispensing anesthetic more slowly and consistently than with a manual syringe. The Comfort Control Syringe has a two-stage delivery system. The injection begins at a slow rate to minimize the discomfort associated with rapid injection. After 10 seconds, CCS automatically increases to the injection rate for the technique you have selected. This rate is pre-programmed into the CCS system. In short, the CCS can make injections easier for the dental professional and more comfortable for the patient. Let's review the content. Installation is a breeze and takes longer to describe than to perform. First, decide on where on the counter or wall you would like your CCS unit located. If you elect to place it on the counter, remove the wall mount bracket. You may also remove the plug from the handpiece holder and use this as a needle recapping station. If you decide to mount CCS on a wall, use the wall mount attachment. Select a wall in your operatory that is most convenient to the patient chair. Securely attach the wall mount to your selected location. Place the back side of the control unit into the wall mount and slide it down. The control unit is now secure. To remove, just lift the control unit upward and out from the wall mount. When the wall mount is in use, we do not recommend using the needle recapping station. Whether you choose to locate your CCS on the wall or counter, you will have the flexibility to easily move the unit from room to room. The compact size of your CCS allows easy placement anywhere. To continue setting up the CCS, simply plug one end of the AC power cord into an outlet and the other end into the external power supply. Then, plug the low voltage cable into the CCS control unit. Turn on the CCS by pressing the rocker switch located on the left side to the on position. If the unload light is blinking, simply press the unload button once. This will return the plunger in the handpiece to the home position. It is this easy to prepare your Comfort Control syringe for use. Let's walk through the controls and the displays which are on the unit as well as the controls on the handpiece. First, the unit. When the CCS is switched on, the power light on the face of the unit will be lit. Beneath the power light are three buttons: load, unload, and double rate. Pressing the unload button retracts the harpoon in the handpiece. Pressing the load button once will advance the plunger and embed the harpoon into the anesthetic cartridge. There are three digital readouts on the unit that display rate per second, which is the injection rate in cc's per second, volume, which is the cumulative volume injected measured in cc's, and elapsed time, which is the elapsed injection time in minutes and seconds. On the right side of the unit are the buttons for the 5 injection types that are programmed into your CCS. These injection types are named block, infiltration, palatal, PDL, and intraosseous. These injection technique selections on the CCS are intended only to be a convenient guide to selecting an injection rate. Your clinical judgment should always prevail in selecting the appropriate rate for each injection. To select a rate, just press the appropriate button. The indicator light will show which injection mode you have selected. When in operation, the digital readouts will display the rate, volume, and elapsed time of the injection you are administering. Now let's review the handpiece controls. The front button with the arrow and square controls the start and stop functions by starting or stopping the plunger. The middle button activates the aspiration function by slightly retracting the plunger. The rear button initiates double rate. Pressing the double rate button will double the current injection rate at any time after the first 10 seconds. 2 beeps will sound to indicate the double rate. To return to the normal programmed rate, simply press the double rate button again. Please note that there is a double rate button also located on the control panel. This operates in the same manner as the double rate button in the handpiece. Now that we have introduced you to the CCS controls, let's walk through the basic operations common to every injection technique. Begin by ensuring that the base unit has been turned on. If not, press the rocker switch to the on position. Load an anesthetic cartridge, metal tip end first, into a cartridge sheath. Insert the loaded plastic cartridge sheath onto the handpiece. Press firmly and twist clockwise 1/8 turn to lock in place. Be sure to fully engage the cartridge sheath in the handpiece. The clear cartridge sheath allows you full visibility of the cartridge throughout an injection. Press the load button once to advance the plunger and embed the harpoon into the rubber plunger of the anesthetic cartridge. Select an appropriate standard disposable needle for the injection. Remove the rear cap and screw it onto the cartridge sheath, just as you would attach it to a standard dental syringe. Leave the front needle capped until you are ready to administer the injection. Before the injection, Midwest recommends that you cover the handpiece with a disposable sleeve, as is typically used to cover dental low-speed motors and air-water syringes. Pulling it down past the cartridge sheath so it covers the handpiece but does not obscure the anesthetic cartridge. Select the appropriate injection type. Remove needle cap. If your CCS is located on a counter, use the recap station located on the handpiece holder. If wall-mounted, use your standard recap station. Press the start button. Once you see liquid drops at the needle tip, press the stop button on the handpiece. The needle has been cleared of air. You do not need to alter your chosen standard techniques for positioning or preparation of the site when using the CCS. As with your traditional syringe, position the needle at the site and slowly insert. If the chosen injection requires aspiration, press the aspirate button. The plunger will retract a short distance. Again, the CCS's clear plastic holder gives you full visibility of the cartridge. After negative aspiration is achieved, press start to initiate the injection. You can see the slow rate at which the anesthetic is delivered. This rate lasts 10 seconds for patient comfort. Then the injection rate automatically increases to the pre-programmed or regular phase for the injection type selected. You may stop the injection at any time by simply pressing stop. If you want to increase the rate of the injection, you can do so at any time after the first 10 seconds of the injection. By pressing the double rate button, the increased rate will be identified by 2 audible beeps. Press the double rate button again to revert to the normal rate. At any time during the injection, you can reference the rate, volume, and elapsed time for that injection. Press stop when you've completed the injection and remove the needle from the patient. Recap the needle using the recapping station, remove the plastic sleeve, press unload, and wait for the indicator light to turn off. Remove the cartridge sheath with the needle attached, turning counterclockwise. Dispose of in any approved Sharps container. Return the handpiece to the unit holder and turn the CCS unit off. Use a wipe saturated with disinfectant to gently wipe all outer surfaces after each use, and then dry the unit off. We hope this video overview of the installation and operation of your new Comfort Control syringe has provided you with the necessary information to begin. The next segment of this video, should you have any additional questions regarding the installation and operation of your Midwest Comfort Control syringe, DENTSPLY Professional has a network of clinical, sales, technical, and dealer resources available to support you. Please contact our product service support staff should you desire additional information on the Comfort Control syringe or any Midwest product.